Hello and welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. My guest is Scott Balderson. He's a physician's associate in the Division of Cardiothoracic Surgery at Duke University Medical Center. And he's here today on the program to talk with us about his work, his role also as part of the care team for Taylor Bell-Duck. Now, Taylor's a 21-year-old lung cancer patient, and he's also going to talk about his involvement with Your Cancer Game Plan. It's a collaboration between Merck and some other cancer advocacy and community groups. Welcome to the program. Glad that you could take the time. And you are, as I said, a physician's associate. Give us a little bit of background about yourself, and we'll start talking about your involvement with Your Cancer Game Plan.
Sure. So I joined the program, the thoracic oncology program at Duke almost 20 years ago after completing my physician assistant training. And joined Tommy D'Amico, a thoracic surgeon there. We were part of a program that was built to evaluate and treat lung cancer patients. A program that, as Taylor alluded to, is made up of thoracic surgeons, medical oncologists, radiation oncologists, as well as radiologists who specialize in imaging of the chest and pathologists who specialize in reading different tumor types of the chest, in addition to research personnel. And our program is only grown over the years as lung cancer rates, as they are, and our population increasing. The number of people being diagnosed every year has only increased over time.
Has your interest in lung cancer specifically, has that always been an interest of yours, or was there some personal connection, maybe some knowledge or something that led you to this specialty?
Sure. Before I went to PA school, I had worked as a respiratory therapist, and so it had an interest in cardiopulmonary issues. I had a family association with chronic lung disease, and when I got out of school, and this is so back in 1997, 1998, the field was just emerging with regards to dedicated services for general thoracic surgery. That is to say, most tumors of the chest were addressed by cardiothoracic surgeons. That would be surgeons that would be might be working one day on operating on somebody's heart, open heart surgery, operating on acquired heart disease, and then maybe would have a lung cancer case the next day, that type of thing. At Duke, there was a real commitment to develop a program that was a singular focus of trying to address malignancies of the chest in an effort to innovate and improve standards of care.
How shocked were you when you found yourself involved with Taylor Bell-Duck, a 21-year-old non-smoker who had been diagnosed with lung cancer?
Herein lies the problem. Unfortunately, lung cancer is far more prevalent than people realize. And to further complicate matters, most people, when they hear the words lung cancer, they immediately associate it with cigarette smoking. Unfortunately, there's still a relatively large cohort of patients who develop lung cancer each and every year that have no history of cigarette smoking whatsoever, nor do they have any history of secondhand smoke.
Wow.
So we've seen those statistics rise through the late 90s and into the 2000s. And again, while the rates have plateaued more in recent years, the population has increased. So therefore, the number of people who are being diagnosed continues to increase over time. I would love to tell you that it was a shock to meet Taylor on that given afternoon, but unfortunately, it was more heart-wrenching than it was shock.
I had no idea that it was as prevalent in the younger population, and did assume that there was some type of smoking involved. So I'm glad that my awareness has been raised. Now, your involvement with Your Cancer Game Plan, was that before, after, or during your encounter with Taylor?
First of all, I have a heart full of gratitude that you're giving us this opportunity, this audience, to be able to speak about this lost population of lung cancer. Just because, as you point out, you weren't aware of it, and so too are a lot of other people out in the public. Taylor has been a true inspiration since we first met back in 2007 at the time of her diagnosis. And since her diagnosis and her subsequent surgery, she's been very inspirational in terms of not cowering to the diagnosis or feeling like it's a situation that has control over her, but that she's had control over it. So, for example, Taylor was quite the competitor, as you pointed out earlier, as a Division I soccer player. So it should come as no surprise that the year after her diagnosis and surgery, she celebrated that 1-year anniversary by running a 5K run, as to not really give in to it. And now, here we are 10 years later, and she's emerged as an extraordinary voice of advocacy for this population of patients, which is critically important because there's just no way for us to be aggressive enough to get the word out. So when Taylor reached out to our team saying that she was going to have this opportunity to give voice to this population through her work with your cancer game plan, it was essentially something that I felt very passionate and compelled to be a part of, to partner with her and to partner with this program, because at the end of the day, I've got to go back to the hospital tomorrow where I'm going to potentially meet a 19-year-old or a 24-year-old or a 36-year-old woman who's newly been diagnosed with lung cancer that's never smoked before. And I'll have to close my eyes and go to that place where I'm able to visualize Taylor and her success and her successful living in the ensuing decade as a source of inspiration to be able to communicate some level of comfort to that patient with regards to how they can successfully navigate their way through this terrible diagnosis.
Now, this awareness effort is a far cry from just being on the shoulders of you and Taylor. Talk about your collaboration with Merck and any of the other advocacy groups that you may be involved with in order to raise awareness.
Sure. Well, obviously things are a lot more global in focus. You know, the beauty of the lung cancer game plan is that it does provide the opportunity for access to other resources, other advocacy groups. So the partnering with Merck is a matter of coming together to provide access and a clearinghouse of some of those resources that patients wouldn't necessarily know about otherwise, which is important in giving them access.
Now, as far as that access, are we talking strictly online for education and awareness, or are there places that they can be directed to in their different communities where they can meet and support each other with physical interaction as opposed to simply online?
Right, exactly. Links that would give them the opportunity to be able to connect on a more local or regional level, which is important because I think a lot of times people just need a nudge and are quite surprised to find out that there's something much closer to them regionally or even, in fact, in their communities.
Give us that website where we can go online and get those resources.
Sure. yourcancergameplan.com.
Right. Scott Balderson, Physician's Associate in the Division of Cardiothoracic Surgery at Duke University. Thank you so much for joining us today. It's been a pleasure, Scott. Thanks.
Thank you so much for having me and giving us this opportunity to try to get the word out.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.